Hello and welcome to Health Matters. I am Mary Alale Yusuf. Now, epilepsy is a chronic, non-communicable neurological disorder which affects people of all ages in every country of the world. It is characterized by recurrent seizures. As of 2012, approximately 50 million people worldwide had epilepsy. Almost 80% of the people with epilepsy are in developing countries. According to the World Health Organization, most people with epilepsy in Africa go untreated. On the program with us today to discuss this is Dr. Mustapha Danesi, a consultant neurologist with the Lagos University Teaching Hospital in Diaraba. You're welcome to the show, Doctor. Let's start with the opening statement. What's neurological disorder and what are seizures?
Well,
and how does it all tie in with epilepsy?
Yeah, neurological disorders are diseases affecting the brain. Seizures is a disease of the brain, and is when somebody suddenly loses awareness of the surrounding. He may or may not convulse. After some time, he recovers and back completely to normal. That is what is a seizure. And most seizures last between 1 minute and 5 minutes.
Okay.
Yes.
So epilepsy is characterized by seizures.
Yes.
You said he may or may not convulse. Yes. Does that mean that there are some where there's no convulsion at all?
Yes. Quite a large number of epileptic patients may not convulse. For example, you may have bouts of abnormal behavior where the patient is unresponsive, is completely cut off from the environment, but he may apparently be doing things that are normal, complex things, and after some time he will recover back. And when you ask the patient whether he's aware that he was doing those things, he's completely unaware. So he may not be convulsive, but he's not aware of the surroundings.
Do we call that unconsciousness?
Well, it's loss of awareness of the surrounding, not necessarily unconsciousness. For example, in such cases, you may have what you call automatism. That is complex behavior that may apparently look normal, but the patient is not aware that he did those things when he recovers. If you ask him, he is not aware. Some may even be singing, or maybe shouting, maybe apparently chewing, or they may be wandering away. They can even go very far away, even crossing roads without being knocked down, and they suddenly found themselves in a strange place, and they didn't know how they got there.
So why would some people be epileptics and others not? What is the cause? What's the anomaly?
Yeah, there are two different ways of looking at it. Epilepsy could be inherent, meaning that the brain can be genetically prone to being triggered off into a seizure.
Is it due to formation in infancy?
No, such people have an inherent predisposition, that is genetic, is inherited in them. Okay. Their brain is hyperexcitable, so they can trigger off into a seizure. When you investigate such patients, apart from the electrical activity which shows that the brain is excitable, there is no evidence of damage at all to the brain. It's just that they are inherently excitable. And there is a history, family history, that either their first degree relative also has such, or their parents, so they must have inherited it. There are seizures that are due to some sort of brain damage. Either they have meningitis as a child, or they have convulsions that damage their brain, or as adults they have accident, this road traffic accident, trauma to the head, leaving a scar in the brain, and that could lead to a seizure, or some sort of damage to the brain, or having a tumor, or some vascular damage to the brain. So this type of seizures are symptomatic. There's a known cause. You can identify a cause, and apart from the EEG, which shows that there's hyperexcitable brain, you may be able to identify some scars that are formed in the brain which triggers off these seizures. So these are the two reasons why people do have seizures.
So could we see it as some sort of disconnect, maybe like an impulse is passing through the brain and it's interrupted or something like that?
Yeah, what happens is that the brain cells surrounding the seizure area suddenly trigger off autonomously and start discharging electrical activity disynchrony with the rest of the brain. They just take off and trigger off a very high frequency discharges, and so they interfere with the normal activity of the cells of the brain, and they can engulf the rest of the brain cells, and they continue to discharge at high frequency and cut off their activity for that period of time. When the discharge settles, everything comes back to normal. So those cells are what they call hyperexcitable cells, which can be triggered off, and then once they triggered off, they start discharging. The brain discharges normal electrical activity, but it's discharging at a frequency that is slow and at a way in which it's not going to interfere with.
Okay, so this one is just like
this one is just abnormal. It just takes off and interrupt every other thing that is going on.
So this condition also affects children.
Yes.
I'm thinking, a class situation, for example, people are learning, and suddenly somebody goes off into one of these, and maybe it's not the convulsive type.
Yes.
So he looks like he's being rebellious or inattentive. Maybe he's been asked a question and he's not answering. Are we aware enough of these kind of things so that a teacher doesn't go and cuff him or slap, or say he's rude?
Yeah, these are situations that needs to be taught to teachers. For example, there is a type of seizure which is very common in children between the age of 7 and 12 when they are in primary school. We call that absence seizure. They just have a brief loss of awareness, and during that time they may just be looking blank for that period of time. After about a minute, they come back to their normal. So when the teacher is talking to the child at that time, he will simply be staring at him without answering. After some time, he will now answer, and you see the report of that child. This child is always absent-minded
in class.
In class. When I talk to him, he will keep looking at me. So not knowing that child has a problem, he has a seizure. So we call that absence seizures. And they do occur several times a day.
Several times a day?
Yes, and such children don't do well. You find out that when they are now identified and then they are now put on treatment, you start them doing so well in class. Because their consciousness is interrupted frequently, they don't do too well. And you see a child, the junior brother or the junior sister overtaking in class is in GSS 2, the junior brother is already in SS2 because of this condition.
But with treatment,
they pick up. They can pick up and recover.
Our responsibility now, as parents, teachers, caregivers, is to notice this lapse, right?
Yes.
And be able to report such a lapse.
Yes.
So this thing is perfectly treatable.
It's treatable.
The question I want to ask is it possible for a child to grow out of it? That is, once he had epileptic seizures, maybe he attains some age, and then he doesn't have any more.
Well, a child, it depends on the type of epileptic seizures. While he has epileptic seizure, it is going to disturb the development of that child. He will not do well in class, he won't do very well until the seizure is treated. But there are quite a number of seizures in children. We call them the benign epilepsies in childhood, from the age of 7 or 8 years. By the time they are adults, they would have grown out of it. They would have, even if they are on treatment, sometimes they no longer need the treatment.
Okay.
And there are other type of seizures, like this absence seizure I was telling you now. Sometimes when they become adolescent and adult, they grow out of that. So there are quite a number of seizures in children that can be more or less cured, because when they are treated well and they stop the seizures, then they will not recur. But usually we do not leave someone with seizure without treatment.
Okay.
The treatment will help such process, because
even if it's going to come out of it eventually.
Yeah, because if you allow seizures to keep coming, the process of the seizure itself will damage the brain, so the chance of their growing out of it becomes less and less.
Okay.
Whereas if it is treated and treated properly, the child may grow out of it. I've treated a number of patients who had seizures as children, who grew out of it. Some of them are doctors now, some are surgeons. They forgot they ever had seizure when they
were children. There's no coming back.
No coming back. They have grown out of it because they had treatment at a particular period. They needed treatment, and it was treated.
So treatment is absolutely essential, whether or not you're hoping that the child is going to grow out of it.
Yes.
Okay.
In fact, if not treated, the chance of growing out of it becomes slimmer.
Yes. Okay. Now, let's talk about the type that comes with convulsions.
Yes.
I'm of the opinion that, these things can happen anytime.
Yes.
So what happens when somebody just falls down and starts to convulse? What should be the action of people around?
Yes.
What informed actions should they take to prevent harm to the person?
Yes. Yeah, the natural impulse of Africans is that they run away, because there's this popular theory that epilepsy is infectious.
Yes, people believe that.
When you touch a convulsive child, the saliva will infect you. That is completely wrong. It's, as we have been talking about, it's a scar in the brain, the damage to the brain that is triggering off.
And it cannot be transferred.
It cannot be transferred to another person. So, having known that, when a patient is having seizure, that time is completely unconscious, so he could injure himself. So the first thing to do is to make sure you clear the area of harmful substances, broken bottles, nails, thorns, because he could roll and injure himself on this. So clear this area of harmful substances. And then, now the other issue is that you should also, if he's wearing a tie, remove the tie. If he's wearing glasses, you remove the glasses. And then, because he could injure himself with those or on the tie or glasses. Then after that, you just lie him in a place, positions, and allow the seizure to take its course. It takes about 2 minutes, 3 minutes of that convulsion.
Okay, so you shouldn't panic, you should just wait it out.
Just allow it to take its course and ensure that it's in a position that he won't harm himself.
Should the person be on his back or her back or side?
He should be on the side, so that the saliva can drool out, so that they can't choke on that. But there are certain harmful things which people do, which are very dangerous. It's very dangerous to start holding the person down. The seizure comes from the brain. So if you are holding the person down, the seizure will continue. You will either injure that person if you are stronger than him, or the person will injure you if he's stronger than you.
All very interesting. You shouldn't hold the person down.
You shouldn't. You shouldn't hold him down, because you will be injuring that person or be injuring you. It's a trigger from the brain, so there's no point. It has a cause. It runs a cause. The other thing people shouldn't do is to put something between the teeth.
That's where there's a problem.
There is this popular belief that if a child is convulsing or someone is convulsing, you shouldn't allow the teeth to touch.
Yes.
That if you allow the teeth to touch, the person will die. That is completely wrong. You should, because putting something between the teeth, it could break that substance and it will inhale it and enters the lung. It will now have an aspiration problem. And then you may choke the person if it's a very big substance you are putting between the teeth. So the issue is that some people say we will bite the tongue. Yes, there are a number of people who have seizures when they are sleeping at night, and they wake up to find out that they have minor bleeding. Even if he bites the tongue, it's not likely to be a small bruise. It's not likely to be that dangerous. But it's dangerous to stick something between the teeth and allow him to choke himself on that, or bite it off and inhale. So that's a dangerous practice.
Some people believe that the tongue is going to roll back and cover his air passage, and that's why they put a spoon.
That's not correct. What you do is to make sure you put the person on the side with the face down, so that the tongue can only roll back when you become unconscious and you are lying face up.
Okay.
But if you are not lying face up and the person is put on the side and allow the saliva to drool, the tongue will not roll back. So there is no justification for doing it.
Okay, so let's take care of this other one. How about salt? I've actually seen where not only the spoon was administered, but they began to pour salt in the mouth of this girl, and they said, that's how it's done, to help her. What's the salt about?
That is another housewife tale. There's no reason, no scientific reason for putting salt.